This topic is about the fetal placental circulation, and inside the umbilical cord, in the beginning, you are having two umbilical arteries and two umbilical veins, but later the right regresses and the left is left. Means the right umbilical vein will regress and the left umbilical vein will be left. So in the beginning, the umbilical cord has two umbilical arteries, two umbilical veins. Yes, but later things are changing. See what happens. Inside the umbilical cord, you are having two umbilical arteries, the blue color and one red color. So you are telling that there is right and left umbilical arteries, the blue color. Why? Because they have deoxygenated blood. And then you are telling that is this the left umbilical vein, which is red color because it is having oxygenated blood. Yes, actually, it is bringing the oxygenated blood from the mother. Mother is sending the oxygenated blood in the left umbilical vein towards the developing brain of the baby, But this blood is going towards the liver. Shall I give it to liver? No, you have to bypass the liver. You cannot give this oxygen to liver. Liver is immature in the baby. So if liver is immature in the baby, you don't want much oxygen to be given here. No, you have to bypass the liver. How do you bypass the liver? To bypass the liver, I have a channel. It is called as ductus venosus. So ductus venosus can take the high concentration oxygen blood, bypassing the liver through the ductus venosus and pushing it directly into inferior vena cava and the heart. So this blood will now go into inferior vena cava and the heart. Yes. When the blood has come to the heart, it will send it towards the lungs? No. Why? Because lungs are immature and they don't require that much of oxygenated blood. So where the blood should go? This blood which has entered the heart has to bypass the lung. How do you bypass the lung? In fetal circulation. See, the blood which has entered the right atrium will bypass the lung by pushing blood directly into the left atrium. If you remember, we have discussed this. So in fetal circulation, right atrium blood should go to left atrium. Yes, passing foramen ovale. Yes, passing foramen ovale. It is required in fetal circulation. And what if some blood has already entered the right ventricle? If some blood has already entered the right ventricle, then that blood would have gone to the lung? No, it is not going, because maybe some blood has entered from the right atrium to right ventricle, but the right ventricle sent it towards the ascending aorta, the pulmonary trunk. So right ventricle is sending it towards the pulmonary trunk, and pulmonary trunk is not carrying it towards the lung. It is using a bypass channel which is called ductus arteriosus. So pulmonary trunk is sending this blood into the ductus arteriosus and into the aorta. Yes, because most of this blood with high oxygen should enter the carotid artery and brain. Mother was sending this oxygen towards the developing brain. So most of this oxygenated blood should enter the aorta and the carotid artery and brain. Yes, that was the function. Okay, so who is collecting the deoxygenated blood then? Deoxygenated blood in the fetus is collected by the aorta into the iliac artery. So deoxygenated blood which is collected by the aorta into the iliac artery, then where is the iliac artery pushing this blood? Into the right and left umbilical arteries. If you say this blood is going into right and left umbilical arteries, the blue color, yes, because they are having deoxygenated blood, they will give it to the mother and ask the mother, could you please make it red color? And mother will say, okay, don't worry, I'll do it. And then the red blood will come back again in the left umbilical vein. This is the job of mother. Fetal circulation. So what will happen when the baby is outside the mother? You mean to say baby is delivered now? Yes. Then the left umbilical vein will be obliterated and it is going to form what is called as the ligamentum teres. And what is ligamentum teres? It is the adult remnant of the left umbilical vein. Similarly, that ductus venosus will be closed after birth and will become ligamentum venosum. Similarly, you'll find that this foramen ovale will close and become fossa ovalis after birth. And what will happen to ductus arteriosus? Ductus arteriosus has two kinds of closure. One is called as physiological closure, which is immediate vasospasm after birth. And then there is a anatomical closure, which is due to intima tunica intima, proliferation, and fibrosis. So you're telling that ductus arteriosus has two kind of closure. Yes, one is physiological closure, which is immediately after birth, and it is due to vasospasm. So our question is asking, vasospasm in the ductus arteriosus is happening when? Different babies, different time, means there are some babies who will have physiological closure in 1 day, and others 2 days, and 3 days, and 4 days. So what is the maximum time allowed? 4 days. And what if it is not having vasospasm of 4 days? Then it is going beyond 4 days, which is 96 hours also. 4 days means 96 hours. If it goes beyond 96 hours, then you have to plan some medical intervention. What is medical intervention? That could be some prostaglandin derivatives. So some prostaglandin derivatives you have to give because already past 96 hour 4 day. Yes, you have to wait till 4 days, and then if it is not having a vasospasm for physiological closure, then you have to proceed with medical treatment. And how much time does it take for anatomical closure, which is tunica intima, proliferation, and fibrosis? Different books give different answer. If you read Gray's Anatomy, it is not matching with the Moore Embryology, is not matching with the OPK Pediatrics, is not matching with the Nelson Pediatrics, is not matching with the Sutton Radiology. Everybody have their own answers. What is the question? Question is, when is the anatomical closure happening? So some books say 1 month, some say 2 months, some say 3 months. But remember, it should happen within 12 weeks. If it is beyond 12 weeks, it is a pathology. You mean to say all the babies must have the anatomical closure of ductus arteriosus by 12 weeks? Yes, beyond 12 weeks, it is pathology. So what do I do? If it is no anatomical closure after 12 weeks, then you have to plan the surgical repair. So I have to plan surgical repair now? Yes. This you have to remember. And then, what is the adult remnant of the umbilical arteries? Umbilical arteries, what they do is they will form some ligaments running towards the umbilicus. And what are those ligaments running towards the umbilicus then? They are called as the medial, medial umbilical ligament. There's a median also. This is not N, this is L, medial. So medial umbilical ligament, yes. Going towards the umbilicus, yes. And carrying the umbilical arteries towards the umbilicus, yes. Okay, now what? Now you have to look at this question, tell me the answer. Where is the mismatch, wrong pairing? So if you are looking at this question and searching for the mismatch or wrong pairing, I think immediately I got my answer. Remember that umbilical artery was not producing the lateral, it was producing medial. So it was not lateral, it was medial umbilical ligament. Then who is producing the lateral umbilical ligament? That you have to see. Also understand that there are some structures in the anterior abdominal wall running towards the umbilicus and covered by some peritoneal fold. So there are some questions on those peritoneal fold. What is this? On the anterior abdominal wall, there is some structures passing like we just saw. Yes, and they are covered by some peritoneal fold, right? So they are having some names which you have to see. But this is the answer? Yes, that is the answer because it is not lateral, it is medial. Medial umbilical ligament, yes. Okay, fine. Let us look at those peritoneal fold now. Where? On the anterior abdominal wall. And what about the anterior abdominal wall? You will see that on the anterior abdominal wall, you are having a falciform ligament, which is a double fold of the peritoneum coming from the umbilicus region and going towards the lever, is carrying the left umbilical vein to the lever. So falciform ligament is a double fold of peritoneum on the anterior abdominal wall. Yes. And carrying left umbilical vein to the lever. Yes. What is the adult remnant of left umbilical vein? Left umbilical vein would have become ligamentum teres in the adult. And who is carrying ligamentum teres in the adult? The same falciform ligament to the lever. So ligamentum teres is also carried by the falciform ligament towards the lever. Yes. Okay. I think we got a question on umbilical arteries producing some peritoneal fold here. Yes. That is, umbilical arteries were producing some ligament and they were called as medial umbilical ligament. But on the medial umbilical ligament, there will be some peritoneal fold. They are called medial umbilical fold. You mean some medial umbilical fold is some peritoneal fold? Yes, it is peritoneal fold over the remnant of the umbilical arteries. Okay, then what about the lateral umbilical fold? Lateral umbilical fold is produced by some blood vessels running towards the rectus sheath, enter the rectus sheath. So we are telling that there are some blood vessels which are forming lateral umbilical fold, some peritoneal fold covering them. Yes, and where are these vessels running? They want to enter the rectus sheath. If you say so, fine. They are the one which produce lateral umbilical fold? Yes. The vessels are called inferior epigastric vessels, inferior epigastric artery, inferior epigastric vein, running towards the rectus sheath to enter the rectus sheath. Then what is this median umbilical fold? It is one in the midline. If you say that is the median umbilical fold and one in the midline, then I think it is covering the allantois. What is allantois? Allantois is a hindgut diverticulum attaching to the tip of the apex of the urinary bladder. So attaching to apex of urinary bladder, you have some allantois in the fetus. Yeah, fetus. In the fetus, there is allantois, which is a hindgut diverticulum. But in the adult, it must be obliterated to become urachus. So you mean to say allantois was having some lumen? Yes. And that lumen is obliterated now in the adult to become urachus. Yes, allantois lumen is obliterated to become a fibrous called urachus, and it is running towards the umbilicus, producing that fold which is called as median in the midline. It is median umbilical fold now. Yes. We will discuss about this later also when we are in the abdomen region.